Welcome back to the channel. In today's video, we'll look at why some traumatic memories remain vivid after the trauma has passed. I'm Lisa Taylor Austin, licensed psychotherapist and expert witness. Some research suggests that trauma memories might not fade over time to the same extent as other personal memories. In a prospective longitudinal study which compared positive and traumatic autobiographical memories, Porter and Peace reported that while ratings of vividness, overall quality, and sensory components declined for positive memories, these ratings remained nearly unchanged for memories of traumatic events. And in a few studies, they investigated the characteristics of very distant trauma memories. Hiskey, Lucky, Davies, and Bruin reported that elderly people with intrusive memories from a distant traumatic event experience these memories as intense and with vivid sensory components. Also, in a study with individuals who reported traumatic experiences during World War II, the vividness of trauma memories and centrality of the event was associated with post-traumatic stress reactions decades after the traumatic event came and went. So this is why many people feel as though they're still reliving their trauma. This suggests that the degree to which an event is vividly recalled and construed as central to identity and life story might be factors that contribute to maintaining post-traumatic stress reactions in the very long term. A new brain imaging study reveals that traumatic memories utilize different neural pathways than normal memories, providing empirical evidence they function as vivid fragments of a present ordeal, rather than processed recollections of the past. Researchers say that the findings help explain why traumatic memories stubbornly persist and involuntarily protrude and intrude as flashbacks and night terrors characteristic of post-traumatic stress disorder, or PTSD. Daniela Schiller of Mount Sinai's Icahn School of Medicine stated, "The brain doesn't look like it's in a state of memory, it looks like it's in a state of present experience." She noticed this when the research team conducted MRI scans of PTSD patients as they listened to pre-recorded audio of their own traumatic memories. So she could see that the brain was reacting as if the person was still back in the trauma. In contrast to ordinary autobiographical memories, traumatic memories fail to activate the hippocampus, which is the area responsible for memory consolidation that places recollections into context. Instead, trauma activated the posterior cingulate cortex, PCC, a region governing introspection, normally disengaged during memory recall. So all of this speaks to why those with PTSD feel as though they're still living in the moment of the trauma or the abuse. They're in a constant state of hypervigilance and feeling anxious, on edge, and on guard. Often, there's a re-experiencing of the trauma through intrusive memories, flashbacks, and nightmares. So clients I work with have reported avoiding people, places, or thoughts that remind them of the trauma, changes in their mood and thinking, including feeling distant from other people, and having overwhelming negative emotions. They report feeling on edge and becoming irritable, easily frightened, or having difficulty concentrating or sleeping, or any of those combinations that I just mentioned. One modality to treat PTSD is EMDR. As an EMDR therapist, I see many of my own clients helped by this type of treatment when all other treatments have failed them. There are over 500 academic studies showing EMDR's effectiveness, at least 40 randomized control studies, which is the gold standard of research, not to mention at least 12 RCS, or response to challenge with children. EMDR is not for everyone, and a person needs to be evaluated for appropriateness of treatment. However, it's worthwhile treatment that you might want to look into if you suspect that you may have PTSD, or if you've already been diagnosed with PTSD. As a side note, CPTSD or complex PTSD is real, but it's not a diagnosis in the United States. It's recognized in countries that use the ICD-11, which is a manual to diagnose people. But here in the USA, we use the DSM-5-TR, which is a different manual to diagnose, and only PTSD is the official diagnosis at the time this video is being made. However, CPTSD often develops over sustained, repeated, or multiple forms of traumatic events. We see this in the intimate partners of narcissists, those in the intimate partners of those with antisocial personality disorder, and other severe mental illness. We also see it in clients who live in communities with violence and gang activity. These are just a couple of examples. There are more. EMDR is helpful to those who have PTSD and CPTSD and is one to consider if you're struggling. If you seek EMDR therapy and you would like to speak with me personally about it, please reach out at my website, which is thetayloraustingroup.com. The link is below in the description in this video. If this video was helpful to you in any way, or if you know someone who you think it might be helpful to, please share it. You never know who you think you may be helping. Thank you for watching, and stay tuned for more videos on this very topic. Take care.